In this video, we will cover the clavicle and the scapula. You can see them here, clavicle and scapula. As you can see here, they are the attachment site of the arm to the trunk of the body. We will start with the clavicle. This knobby end here is the sternal end because it's where it attaches to the sternum. This can also be called the medial end. This flatter, thinner end is the acromial end because it attaches to the acromion process. It can also be called the lateral end. If we flip it over, this protrusion here is called the conoid process. For the clavicle, you'll need to know rights and lefts. So to start, we will start by finding the sternal end here, and then the conoid process. The conoid process will point down and back. So we have medial end, conoid process pointing down and back. So this would be a left. So if you look over here, we have the sternal process and the conoid process pointing down and back. So then this would be a right. We will now go over the scapula. To start, we're going to flip it over and go over the posterior portion. So this is the posterior portion, and we can see this large protrusion here, which is the acromion process. This long, large spine is called the spine. Above the spine, we have the appropriately named supraspinous fossa. Then below the spine, we have the infraspinous fossa. This portion here is where the humerus attaches. So we know that this has to be the lateral side. So this is the lateral side here, and this teardrop portion is called the glenoid cavity. This long edge is the lateral border. It can also be called the axillary border because it is by the armpit. This pointy portion here is called the inferior angle. And this side edge is called the medial or vertebral border because it is close to the vertebrae. Continuing upward, we have the superior angle. It can also be called the medial angle. This ridge here is called the superior border. And this indent here is called the scapular notch. From this view, which is the anterior view, we can see this protrusion, which is called the coracoid process. And then this large surface is the subscapular fossa. For the scapula, you'll need to know rights and lefts. So it's important to remember that the spine will be posterior. And I remember this because you can feel it pretty easily on yourself. So that has to be in the back. So the spine is on the back, and then this area is where the arm attaches. So this has to be laterally. So putting this together, the spine is in the back, and this is pointing laterally. This must be a left. So then over here, the arm attachment point is going to point laterally, and the spine again is in the back. So this would be a right scapula. Sometimes I like to double check and just kind of make sure that that makes sense. So again, the spine in the back, and then the glenoid cavity will be where our arm attaches.